Hi, good morning. In fact, for some of you, maybe good evening. But that said, let me jump straight into it. So this is the ZP Developer Zone webinar. We like to do this. Well, I say once a week, but actually ends up being twice a week these days because we do get a lot of questions. And I've also gone a little bit early, about 12 hours early. So my apologies for that if you're expecting it live. But I am going live now, but I had to go early because so many meetings are stacking up. But let me go quickly. I'll talk fast, but it's because we've basically got a lot to get through. So question one is about gold electrodes. So at ZP, I think we do a really good quality gold screen printed electrode. I know it's good quality because we use it ourselves in a lot of our programs with clients. And I'll talk about the quality system behind it. And I'll also talk about the difficulties that our clients having with that gold electrode. And then I'll also come up with the root cause as to why they're having problems with that screen printed gold electrode. Number two, client is using potassium sensors from Zimmer and Peacock, and they're working fine. Then they're using the lactate sensors from Zimmer and Peacock, and they're not working so fine. Quick analysis from my side, I think, is that potassium sensor is open circuit potential, so it's using the working electrode and the reference electrode. That's fine. When they use the lactate sensor, it's amperometric, so it's using the working electrode, the reference electrode, and the counter electrode. That's not good. So quick logic tells me that the problem is on the counter electrode, and I got a suspicion it's electronics, but I will dig into that. Question number three is detection of lead, cadmium, and zinc in water. Super interested in heavy metals. At ZP, part of our business model is to support startups. So we're in contact with a startup. The startup's in contact with the university. And so I'll just talk about, I can only focus in on our lead detection today because that's what I have the data for. And then finally, a client or potential client interested in CGM, continuous glucose monitoring. I will talk about the technologies we have. I'll talk about the lowest cost way of at least getting a CGM, proof of principle going. And I will talk about the realities of CGM development. Now, I know my reality will be the USA. Well, I'll be talking about the USA, where companies have to raise more than $100 million to really get a continuous glucose monitoring technology onto the market, and I'm much more than 100 million. So even if you kind of imagined yourself being able to do it in a low-cost area at 10% of that, you're still talking $10 million. That said, we've got two upcoming webinars. At ZP, we're super interested in the commercialization of electrochemical biosensors. So we have a platform, we describe it as an OEM, an original equipment manufacturing solution, which basically means that the business model is to partner with other people, other companies, I should say, and that means then that they can use our platform to build their technology upon, they go to market, and we can be in their supply chain. We do two sessions, one in the morning, one in the afternoon. The reason being then that those time zones, it allows us, the nice thing about sort of living in Europe is then that we're kind of we're in the middle of all the time zones. So the morning works well for people in Asia, and the afternoon works well for people in the USA, Canada, Central America, South America. If any links pop up, by the way, I'll also put the links underneath the video as well. And we're also doing a dedicated webinar for academia as well. Same idea next day, but one in the morning, one in the afternoon. So if your focus is purely on academic research, there's a webinar for you. And if your focus is more on the translation of research into products, which is something I'm super interested in, then we'll touch upon that as well. Let me go forward a little bit faster. Question number one. So I'm super proud of our screen printed electrodes at ZP. Like I say, I'm kind of certain of the quality of them because actually we use them a lot ourselves. And you'll also see that by default, we actually have quite thoroughly tested electrodes before they leave our facility. I think what happens is, a lot of what happens in this world is that people are screen printed electrodes. They may not, the people selling the electrodes may not even be the original manufacturer of them. And if they are the original manufacturer of them, they may never have actually used them. But at ZP, we are generally a very active electrochemistry group. So in fact, all the electrodes are used or being tested in some way by us in usage or by us as part of quality control before they leave the factory. So at ZP, we do have a whole series of, I would say, really good electrodes. There's rectangular format and the circular format. I know that people really quite like the circular format because they can just pipette onto it. The drop sort of spreads out and dries, and they can easily functionalize the sensor that way. Now these particular people are actually using our hypervalue gold electrode. So I will be, again, if a link appears, I'll put the link underneath the video as well. So I'll go forward hopefully fairly quickly. I do have advice on the website that, you know, I say with gold electrodes, they do tend to pick up material from the atmosphere quite readily. So when we fabricate gold electrodes, we either ship them to clients or we use them ourselves. And when we use them ourselves, we give them a little bit of a clean. We're very careful not to just flood the whole screen printed electrode with 10 millimolar HCl. We actually tend to keep it on the working electrodes. And I could have made a better job of describing that, but we do have videos about this. But before we ship them, we will test them. And I've got the genuine test data. So this client's having a problem. I actually have the genuine test data of those electrodes before they left our facility. I think this is something really good about ZP is like, you know, we can't fob, well, we don't fob people off. We actually have the evidence of what's going on. So before we ship our electrodes, we have a little simple, and I say simple, you know, people imagine that we're just doing 1 or 2 electrodes. You're about to see a whole ton of data that, you know, we will do a lot of testing. Sometimes people say to us, oh, well, I want you to do a custom electrode and I just want 300 electrodes. We can make 300 electrodes on 1 sheet. We're producing 20 sheets at a time, and this is still low volume manufacturing, you know, so we're talking about 6,000 electrodes will be a small run for us, and we sell them quite regularly as well. So we do test the electrodes quite a lot. We would use a redox probe like ferricyanide, and we save all our data to Julie. Julie is a database that you'll hear refer to a few times today, but ZP, the heart of ZP, I would say, is Julie. You know, in the end, we make electrochemical sensors. We're really in the data game, the data and information game, and electrochemical sensors are a conduit for data and information. We put all our data information in Julie. So it's a bit of one hell of a claim, but world's best gold electrodes. You know, I sort of kind of mean it, to be honest with you. I think we really put an effort into making good screen printed electrodes. Why? Because we need them. We need good quality gold electrodes because actually, even today, you know, we have very large clients with very large budgets doing large programs with us. And it's absolutely imperative that we have a good quality gold electrode for that kind of work. So when we make these gold electrodes, we'll grab sheets and we'll start sampling electrodes from those sheets. So there's 8 here, 8 here. Sheet 10, there's 8 there, I think, yeah, 8. Sheet 15, we test 8. Sheet 20, we test 8. Sheet 30, we test 8. So we're testing the sheets. You know, you can imagine, you know, we've got a production run. We're grabbing the sheets and we're testing them. And we're actually uploading the data to Julie, and Julie is automatically analyzing the data. Now, the reason I bring this up is because I know the quality of those gold screen printed electrodes when they left the facility. I can also explain why the client's having a bit of a problem as well. So they have been using a PalmSense potentiostat. Partly through these slides in a minute, I will ask them, and I have asked them to send me a photo of their setup because I want to see it. But I've looked at their setup. There's nothing wrong with it. They're fine. But they're getting data that looks like this. First of all, I thought maybe they weren't putting ferricyanide in there, but they tell me that they are. When I see data like this, it looks like it's basically acting like a resistor. It's not acting like an electrochemical cell. It's acting like an electronic resistor. This is basically following Ohm's law, that V is equal to IR, so they change the voltage, the current just changes proportionally. So I already have a sense that there's in fact, if I was a bit smarter about this, I would have, maybe I can do the calculation, 0.4 over 1 microamp. I'm going to make a quick guess at this. I think this is acting like a mega ohm resistor, is my quick, you know, because I'm just doing an Ohm's law type calculation on this. So it's acting. In fact, that even tells me the root cause of this a bit more because it's so high impedance. You know, they've done some cleaning, but it's still acting like a resistor. So I know what the electrodes should look like. When they're testing, they're not looking anything like it, which is interesting to see because when I was showing that data earlier on, each image I was showing was 8 electrodes. So I've done 8, 16, 24, 32, 40, probably about 48 electrodes, and they all look good. Everything this person does looks bad. So then you have to use logic. You say, oh, were they just lucky at ZP that they tested 48 good electrodes, but then they shipped these electrodes and they're all bad? No, it tells you that there's actually a difference. I think the most logical explanation is actually there's something different between our setups. And, unfortunately I have seen this before as well. The nice thing about ZP is that we are, obviously we try to make a good screen printed electrode. We put it on the web store, but we are able to support it because this person was having a go, and I appreciate they're a good person. They're trying to, do some good work here. They were doing a cleaning process, and I said, you have to stop this cleaning process because what you're doing is you're stripping the silver off the reference and counter electrode and you're actually depositing it on the gold electrode. So I did get them to stop that, and they did stop doing it. It's slight improvement at this point because they're starting to get the features of ferricyanide, which is the redox probe that I asked them to use, but it still does not look like this. It still looks like a kind of a high impedance resistor. So they've been trying this, but and I appreciate that they're trying, but I think it comes down to what we call a, not what we call it, is a poor connector. I suspect that I've seen this once before, that we were working with somebody who was using our electrodes, and they were trying to test ruthenium hexamine. They were expecting some beautiful results. When I say expecting, this is the results they actually got off the screen printed electrode in the end. They got this nice cyclovoltammetry, and that's what we expected. But so they were expecting this for a while there. They were actually getting something a lot more distorted, with hardly any features. So same solution, same electrode, but the difference was when they were first doing this, and I'll slightly drag my image out of the way. When they were first doing this, they were using the connector from the vendor they had. The connector, the pins in this connector do match the ZP screen printed electrodes. They do match the pin, but for some reason they don't quite make good enough electrical contact with the ZP sensors. So we ended up developing this connector here. So I have asked this person, and I said, send me a photo of your setup because I want to see how you're making an electrical connection here. Because I think basically what's happening is you have a high impedance connector. Why? Because the batch was tested before it left us. 48 electrodes at least were tested. They all look, pretty beautiful, to be honest with you. And then everything that you test is bad, even though you're cleaning it. But I think actually your problem is you've got a high impedance connection to the screen printed electrodes. Send me a photo of your setup, and then I can. Somebody else, and you'll see in a few slides time, has also sent me photos of their setup as well, and it really helps me with troubleshooting. So I think the connector you need is this connector. I think it has a slot here that's 7mm, which is perfect for the hypervalue electrode. And then because you're on a palm sense potentiostat, then palm sense potentiostats have 2mm banana plugs. So this is for 2mm banana plugs. So I think your problem is not so much your sensors, or your screen printed electrodes. I think it's actually your connector, and it rings. I have seen this before, and I have shown you data here that looks a little bit like what you're getting as well. Question number 2 is about a lactate sensor. So let me dig into this. So this person's having a problem with a lactate sensor, which is also quite nicey because they actually, very nice. This is their data. Now they have also got a potassium sensor off us. So I feel like sometimes troubleshooting electrochemistry is like being a bit of a detective. So they have a potassium sensor. This is their data. This is our data. And that's also our data as well. But their data, which is labeled my data here, looks a lot like our data. So potassium sensor is working fine. Okay, good. That's good. Now they have a problem with the lactate sensor. And I will dig into this. It's flat. It's not a little bit flat. It's flat. This is basically no current is flowing. This is... And I can immediately tell that I got a suspicion. In fact, I can use logic. Is the problem on the working electrode? No, because the potassium sensor works fine. Is the problem on the with the working electrode? I don't think so, because the potassium sensor is working fine. Is it on the reference electrode? No, because I think the potassium sensor is working fine. I got a suspicion it's on the counter electrode, but I'll build up the story and the evidence for why I think the problem's on the counter electrode. So the good news is, I mentioned earlier on that we tested the screen printed electrodes for the questionnaire number 1 before they shipped. So I was actually able to bring the data into, I was able to bring the data to this slideshow and show you now the good data. We also tested these sensors just before they actually got shipped. So actually I do know that the sensors were functioning right. And because it's Julie, I actually know who did it, when they did it, the equipment they used, everything, because Julie, and by the way, Julie is available to other people to use as well. It's just a cloud system. If you do come to one of our webinars, you'll see Julie in action as well. Anyway, let me go forward a little bit. So I know the sensor was good because actually we tested beforehand. Now, this person, absolutely admire what they've done. They filmed themselves, which is really good then, because I was then able to follow their film basically, and I could see what they were doing, putting the sensor into the instrument here. I'll comment on this in a minute, that they may have a little bit of weight on the front of the sensor that may be affecting the contact, but I'm not, I suspect, that it's possibly not that, but that might be I saw the solution they were using, so I could see the way they were doing the pipetting, so I had no, criticism of it or, comment on it. I could see that they were doing coronal amperometry. I could see they were using 650 millivolts. I could see that they were doing a 1 second save rate. I could see they were trying to run for 600 seconds. So, nothing wrong with any of this. And I could see that they were selecting the right kind of current range. So, no comment on that. The only problem is it's just flat lined. When we knew the sensors when they left the facility were showing response to lactate. So there's a mismatch. There's something going on at the new facility, let's say, where these sensors are residing. So I feel, well, in fact, the sensors were good when they left us. So I got a suspicion the problem doesn't lie on the sensor. Now, I've just put a potentiostat circuit in here. The first thing to say is that they do get nice data when they're running potassium. So that tells me that the instrument they're using is fine on the working electrode, is fine on the reference electrode, because that's what the potassium sensor is using. But then when they go to the lactate sensor is using, it's a 3 electrode system. So it uses the working, it uses the reference, and it uses the counter. I got a suspicion that the problem is there's something wrong with the connection on the counter electrode of that potentiostat. Now, why do a couple of things I observed. Like I say, I'm a bit worried that maybe the weight of this is actually pulling, I know it sounds ridiculous, but slightly flexing this so it's actually not making a good electrical contact. That could explain that counter electrode connection issue. I also noticed this as well. It's very small, and I doubt this is the problem, but it's worth at least thinking about whether there's actually sufficient power coming from this USB hub to actually run that potentiostat. So no criticism of you. This sometimes happens, that you may just be slightly underpowered, and that's sort of, I'm not saying messing up the potentiostat, but that could be something that's happening. We've had problems like this in the past, and so what I would suggest is there's actually a what's called a LEMO connector on the back of this instrument. If I had a better picture, I'd give it to you. But I can see your instrument. There's a cable that comes, that can come rather, and those cables come with 2mm banana plugs. So I got a suspicion that you need a cable and a connector, because I feel quite strongly that your problem is it's not the sensor, and actually that instrument, that connector at the front of your instrument is working fine as long as it's only the working reference being used, but there's something wrong with the counter electrode pin. I think it might be slightly better to actually come with a cable from the back side, and then you'll need a cable and a connector, and I've linked to the right cable and the right connector here. Yeah, and I put a little picture as well, so that's what it's going to take you to. Question number 3 is about lead sensors. I've been interested in, unfortunately, water quality is a global issue. Really interested in helping people solve this problem of at least understanding, things like heavy metals, from arsenic to lead, for zinc to cadmium in water. Most of the data we have that's gathered at ZP is actually on copper, which is not relevant to this conversation, but also on lead. So I will talk about our lead system today. I realize I have technology up on the shelf that I would like to grab, but I'm in the middle of the webinar, so I won't grab it now. But at Zimmer Peacock, we do have a platform called Sense It All. Sense It All does not exclude you from being a good scientist, because actually when the instrument runs, all the raw data goes to the cloud, so you're still part of the scientific process. But what we have is this. Look, we have, I've mentioned screen printed electrodes several times today. We make really good electrodes, really good biosensors. We check the quality before they leave our facility. this really accelerates academic research, actually, because I think so much of academia is actually just dealing with slightly shoddy screen printed electrodes, which the variability in the screen printed electrodes is sometimes the same size as the signal that you're trying to measure, and it sort of confounds you. Anyway, we make good sensors, we make good electrodes, we make a good bit of hardware called Sense It All. I wish I could go and grab it. It's just up there. It fits in the palm of my hand. We have an app. The app is called Sense It All. It's on the App Store and it's also on the Google Store. And we have the Julie database. The meter is told what to do by the app. So we'll have a QR code for lead, for example. And the meter will give the result back to the app. The app will send the data to Julie. This is important because then it gets processed to being ppm, millimolar, but I think for heavy metals, ppm is actually more interesting. This is the important bit. Every time you run a sample on that instrument, all the data is going to the cloud. So you can do some validation in your lab, and you can be, say, oh, I tested known solutions, I got this result, but actually you can go and see the raw signal. But just know this, that when you then ready to scale and send it out to where people would really benefit from this technology, you'll still get the raw data because the raw data is still going to the cloud. So you can always be looking at signals and saying, right, is this working correctly? Yes, no, how do I improve it? So it's a really good system because it will allow you in your lab to run and get the raw signal, but it will also allow you to get the raw signal from the, let's say, the field or the real world, because even though the real user would actually get millimoles or ppm of lead on their phone, you will actually have access to the raw signal as well, and so you can still basically be the scientist, checking on things that are working correctly. You can also share it with people like us or share it with your internal team. And when I say share, this is not emailing data back and forth. This actually resides in the cloud, and as long as another person has an account on the cloud system, you can just invite them using their email address, so they can also share the data as well. So it's a very, very good technology for translating technology from essentially the laboratory and putting it into the real world. It also has what's called an API built into it, an application program interface, especially in the water, let's say, water sanitation world. There are databases that people want you to plug into, and the way you'll plug into it is actually using the API called the application program interface. We have tested lead, and I will talk about, you can actually improve the limit of detection on lead if you start playing with time. But in this case we haven't optimized too much, but we've tested from 1 ppm to 200 ppb. I shouldn't say ppm. I realize this is ppb. So it does give you a sense of the sensitivity of this. What I would say is this, that 1 and 2 ppb, we just can't see the difference. So I wouldn't want to make a call that we can actually resolve that. But 5 ppb we can see, 10 ppb we can see, 20 ppb we can see, 50. So it's, I'm sort of saying that our limit of detection hovers somewhere between 2 and 5 ppb. But really the limit of detection, when you get into the real world and there's all sorts of interferences, I don't want to sort of speak too much about that, but I would say that at least in these synthetic solutions, our limit of detection hovers between 2 ppb and 5 ppb. Sorry for the ppms earlier on. So a very, let's say, product looking platform. The real end users get the kind of results on their phone in ppbs, but you also get the raw data, which is really important for kind of validating and verifying the science. Why are we doing this? Because otherwise I think too much science never really leaves the lab and it doesn't really impact on people's lives. Any links that I've got here, I'll also put them underneath the video at the end as well. I'll go a little bit faster now. Question number 4 is about CGM, continuous glucose monitoring. At the end of this, I'm actually going to list out 3 pieces of, let's say, I'm going to list out electronics, sensor, and test solution that I think, as a minimum, you buy those 3 and you can at least do a demo in front of investors, for example. But it's a bit of a story to get there. At ZP, we've been doing wearable transdermal biosensors for quite a long time. So we work on wire sensors like this, and those are on our website. We do work on microneedles. We have 50 patents on microneedles. We have worked on sweat. I'm not going to suggest sweat for glucose. There is a company in San Diego doing this. I would say that speed to market, I mean, the FDA just released a kind of an opinion piece where they said, if the sensor doesn't break the skin, then they can't really trust it to measure glucose. You could possibly look after people's wellness or well-being using sweat analysis, but you can't it's not clinically proven that you can look after type 1, type 2 diabetics by sweat analysis. So I wouldn't go there for the time being. At ZP, we do work on implanted sensors as well. I know the person asking the question knows about this, but let me repeat it for other people. So I will talk about that as well. I'm not going to talk about the bioelectrochemistry of CGM. I think this has been done by us lots and lots of times. But if people are so interested, just reach out to us and we'll do another video on it. Just for interest, I mean, this package here, I've got the dimensions here. 15 millimeters, 38 millimeters long. And we've functionalized this to be used in fish. This fish is not dead. This fish is anesthetized, and actually the whole package actually gets deposited into the fish, and then the package is actually completely. Essentially, we're sending data from these fish as they're actually swimming around this tank. This tank is recirculating water, so it shows you the level of technology that we do have at ZP, that we're actually able to do this, because measuring the glucose in fish while it's swimming, without any cabling between the sensor and the outside world, it's all telemetry, is pretty good, let's say. We also do a lot of transdermal sensors. I do have one just here. I don't want to reach out because I don't want to break the video, but we do have a lot of technology around microneedles, where we actually have the microneedles on the backs of smartwatches like this. Though we're not married to the idea that it has to be on a smartwatch. We do understand that there's more traditional places to place a CGM. So even though we show it on the wrist here, we're not. Now with this technology, there's actually something like 50 patents behind this. So it's a substantial patent portfolio that we have at ZPM. I only use this image because this image doesn't belong to me. It just highlights a company called BioLink. They're down in San Diego. These guys have been around before they raised their 100 million. I think they've been around for about 7 years previous to that. So it does tell you that CGM, it's easy to say that these guys now at least 10 years on this. If they may be in their 10th year, so they've been doing this a long time. They're using microneedles, and they've raised so far $100 million US. I did hear the other day that Dexcom may have raised something like $500 million US before they actually got to market. It's a lot of money, and I think you can actually do it a lot more efficiently these days, because when Dexcom were doing it, I don't want to be ridiculous, but they were sort of 20 years ago when they were doing it. So they were really what I call breaking ground, whereas they've kind of given us all the blueprint now, and well, blueprint's too strong a word for it, but they've shown us what is possible. So it's easier to sometimes be a Me Too product than to be the original, let's say, Dexcom. And if you read the Dexcom patents, their work's actually heavily inspired by a gentleman called George Wilson. Anyway, the reason I bring this up is because you can see the kind of money that was raised or is being raised even today to do CGM technologies. And even if you were in a low-cost center or a low-cost part of the world, even if you did it at just 10% of this cost, that's 10 million. So I have to put that out there because people have to have a perspective of what they can really achieve if you're trying to monitor diabetics doing this kind of microneedle type technology. Now at ZP, we do have these a lot of technologies that people can come along and get on the website. I'll put a link here. But if you want to do a demonstrator, you need electronics, you need test solutions, and you need glucose sensors. At ZP, these are three things. I think I did a quick mental note of this, and this was approximately I think approximately 2,000 US dollars or something like that. But that will get you a sort of proof of principle kit. So sensors, electronics, and glucose sensors, I will put those links underneath the video here. Question number 1, gold electrodes. Your gold electrodes are distorted. I need a photo of your setup. I got a suspicion that your connection is the issue. Those gold electrodes were tested before they left the facility. I've seen this kind of problem before, and there it was a connector that was the issue. Your lactate sensors, your signal is completely dead on the lactate sensor. Completely dead. So basically there's no current running through the circuit. I suspicion it's on the counter electronic side of your setup. That's the problem. Detection of lead, I think that limit of detection hovers somewhere between 2 ppb and 5 ppb. Just out of interest, we haven't over optimized it. I'm sure you can do better, but we do have a technology platform that will allow you to validate in the lab and start getting into the real world pretty quickly. CGM, continuous glucose monitoring. ZP does have a lot of experience in it, both the patent portfolio and the work that we've done on microneedles transdermal. 50 patents. You can imagine the cost of trying to upkeep 50 patents. So we're very judicious in who we work with on microneedles, though we have got some microneedle technology on the website that you can just buy and get on with. But to really do something as CGM, you need to engage and be involved with people like ZP. And you can see the kind of monies that other companies have had to raise in order to be in the CGM space. But if you want to have a quick go at making the CGM technology, then I have put the electronics, the sensor, and the test solutions that you would otherwise need. So I want to say thank you. My apologies for going about, I've gone about 11.5 hours or 12 hours early on this. Just lots and lots going on tomorrow, so I had to go early and do it later. That is my time this evening. Okay, thanks very much. If you have any questions, don't hesitate to reach out to us. Okay, thanks so much.